Hello everyone. Today we will be covering the topic about drugs affecting the central nervous system. Anticonvulsants. Factors that may precipitate seizures include sleep deprivation, high caffeine intake, hyperventilation, stress, hormonal changes, sensory stimuli, drug or alcohol use, infections, fever, and metabolic disorders. Anticonvulsant medications being used in the treatment of mood disorders. Anticonvulsants. Essentially, anti-seizure drugs act by the following: stimulating an influx of chloride ions. Usually this is associated with the neurotransmitter gamma-aminobutyric acid. Delaying an influx of sodium, delaying an influx of calcium. The hydantoins. Phenytoin, with the brand name being Dilatin. Ethatoin, with the brand name being Peganone. And phosphatoin, with the brand name being Cerebrix, are the first-line treatment of choice for tonic-clonic and partial complex seizures, and are the least sedating drugs used to treat seizure disorders of any type. Phenytoin is the most commonly used. Pharmacodynamics. Works by stabilizing neuronal membranes and decreasing seizure activity by increasing influx of sodium ions across cell membranes in the motor cortex. Onset and duration varies. Pharmacokinetics. Metabolism in liver. Strong cytochrome P2C9 effects. Levels will increase with cimetidine, diazepam, acute alcohol intake, valproic acid, and allopurinol. Decrease effects with barbiturates, antacids, calcium, and chronic alcohol use. Drug interactions. Concurrent administration causes the decreased effect of the following: carbazepine, estrogens, acetaminophen, corticosteroids, levodopa, sulfonylureas, and cardiac glycosides. Adverse drug reactions. There are many. Never give IV or IM in primary care setting. Watch patients with liver and renal disease closely. Most common: nystagmus, dizziness, pruritus, paresthesia, headache, somnolence, ataxia, and confusion. Cardiovascular effects include hypotension and tachycardia. Gastrointestinal effects include nausea, vomiting, anorexia, constipation, dry mouth, and gingival hyperplasia. Genitourinary effects include urinary retention and urine discoloration. Hydantoins are used for the treatment of grand mal and psychomotor seizures. Phenytoin, however, may worsen absence seizures. Monitoring. Baseline laboratory values and plasma levels, along with thyroid-stimulating hormone, also known as TSH. Need to assess over-the-counter drugs such as ibuprofen and antacids. Patient education. Discuss risk factors for seizures. Report adverse drug reactions. Avoid driving if not seizure-free for more than 1 year. Oral hygiene. Advise the patient to maintain good oral hygiene to prevent tenderness, bleeding, and gingival hyperplasia. Carbazepine, which include the brand names of Tegretol, Tegretol XR, and Carbitol. Oxcarbazepine, which includes the brand name of Trileptal, valproic acid, which includes the brand names of the following: Depakote and Depakine. Pharmacodynamics. Depressed neuron transmission in the nucleus ventralis anterior of the thalamus. Has black box warning for causing blood dyscrasias. Has ability to induce its own metabolism, and genetic testing of Asians. Pharmacokinetics. Absorbed through the stomach, metabolized in the liver. Induces metabolism of many cytochrome P450 substrates. Grapefruit juice increases serum levels and effects of carbazepine. Drug interactions. Watch out for intake with grapefruit juice. Drug levels increase with concurrent use of propoxyphene, with the brand name being Darvocet, cimetidine, erythromycin, clarithromycin, verapamil, and hydatins. Decreases plasma levels of several drugs, including beta blockers, warfarin, doxycycline, succinimides, and haloperidol. Adverse drug reactions include the following: depression of bone marrow, liver damage, and impairs thyroid function, drowsiness, dizziness, blurred vision, nausea and vomiting, dry mouth, diplopia, and headache. Monitoring. Baseline laboratory values include complete blood count, chemical panel, hepatic panel, and thyroid stimulating hormone level. Patient education. Teach about symptoms of bone marrow depression, careful use of medications, therapeutic dosings, kindling. Anticonvulsants, succinimides. Used for treatment of absence seizures in children and adults. Ethosuximide, with the brand name being Zerotin. Methosuximide, with the brand name being Celotin. Pharmacodynamics. Suppresses seizures by delaying calcium influx into neurons. Decreases nerve impulses and transmission in the motor cortex. Absorbed in GI tract. Pharmacokinetics. Metabolized in liver. Adverse drug reactions include the following: GI being the most common, central nervous system including the following: somnolence, fatigue, and ataxia, agranulocytosis, aplastic anemia, and granulocytopenia. Other adverse reactions may include headache, rash, pruritus, and mood changes. Symptoms of toxicity are a worsening of these adverse reactions. Cases of systemic lupus erythematosus have been reported with the use of succinimides. All AEDs increase risk of suicidal ideation. Anticonvulsants, lamotrigine. Lamotrigine, with the brand name being Lamictal. Used in the adjunctive treatment of primary generalized tonic-clonic seizures and partial seizures in adults and children older than 2 years of age. Concurrent use with valproic acid and phenytoin. Pharmacodynamics. Levels are decreased by the following: barbiturates, estrogens, phenytoin, and mefloquine. Levels are increased by the following: alcohol, carbazepine, central nervous system depressants, and valproic acid. Pharmacokinetics. metabolized in liver and kidneys. Adverse drug reactions include the following: GI, mostly nausea, vomiting, and constipation; cardiovascular, which includes chest pain and peripheral edema; central nervous system, which includes somnolence, fatigue, dizziness, anxiety, insomnia, headache, amblyopia, and nystagmus; and dermatological, which includes rashes. As discussed in the precautions and contraindications section, lamotrigine has a black box warning regarding serious, possibly life-threatening rashes, including Stevens-Johnson syndrome, also known as SJS. Patients taking lamotrigine for any reason may have increased suicidal thoughts or behavior. Lamotrigine may cause increased seizures, including status epilepticus. Patient education includes the following: adherence, avoidance of alcohol, avoidance of over-the-counter drugs, adequate hydration, reporting any new drugs, and reporting adverse drug reactions. Discussion of risk factors that contribute to seizures, driving, and controversy about discontinuing medications after a few years of being seizure-free. Neurologist will make the decision. Anticonvulsants, rufinamide. Adjunctive treatment for Lennox-Gastaut syndrome, also known as LSG, modulates the activity of sodium channels, contraindicated in familial short QT syndrome. Adverse drug reactions include increased suicide risk and DRESS, which stands for drug rash with eosinophilia with systemic symptoms. Interactions include carbazepine, phenobarbital, and valproate. Hello everyone. Today we will be continuing our discussion about drugs affecting the central nervous system. The antidepressants are usually identified in 5 classes, the first being TCAs. The second is selective serotonin reuptake inhibitors, also known as SSRIs. The third being monoamine oxidase inhibitors, also known as MAOIs. The fourth being serotonin norepinephrine reuptake inhibitors, also known as SNRIs. And the fifth being atypical antidepressants. Please see slide 2 for comments. Tricyclic antidepressants, also known as TCAs. The development of TCAs grew out of work with phenothiazine, to which they are structurally related. Imipramine, with the brand name being Tofranil, is the prototype drug. Nocturnal enuresis, intractable pain, and anxiety disorders. Pharmacodynamics include act on neurotransmitters, serotonin and norepinephrine, and histamine and acetylcholine. Pharmacokinetics have fairly long half-life of 6 to 18 hours, and liver metabolism strong with cytochrome P2D6. Adverse drug reactions. Anticholinergic adverse effects are common and can include dry mouth, constipation, urinary hesitancy or retention, blurred vision, sedation, orthostatic hypotension, weight gain, nausea and vomiting, gynecomastia, and changes in libido. Patients newly prescribed a TCA should be cautioned about safety in a situation in which mental alertness is required until the full effect of the drug has been determined. Patient education. Do not discontinue abruptly. Avoid over-the-counters. Must let provider know if having myocardial infarction or glaucoma. Monitoring. Must report any chest pain. Reassesses patient after 2 to 4 weeks of starting medications, suicide, and adverse drug reactions. Baseline electrocardiography, also known as an EKG. A preliminary EKG should be done with QT correction and repeated after 3 weeks. Plasma levels can be assessed to assure delivery of an adequate dosage and to support patient adherence. MAOIs: phenelzine, isocarboxazid, tranylcypromine, and selegiline. Inhibit monoamine oxidase, the enzyme that terminates the actions of neurotransmitters such as dopamine, norepinephrine, epinephrine, and serotonin. Have a low safety margin. Not a first-line drug. Have many drug-to-drug and food-to-drug interactions. Most common side effects include dizziness, headache, insomnia, restlessness, and hypotension. Adverse drug reactions include the following: orthostatic hypotension, hippuric acid, insomnia, diarrhea, hypertensive crisis when used with other antidepressants or sympathomimetic drugs or foods containing tyramine. Pharmacodynamics. They inactivate the enzymes that metabolize norepinephrine, 5-HT, and dopamine. They prevent the breakdown of tyramine found in many foods. Pharmacokinetics. There's a major first-pass effect of liver metabolism, and most have a cytochrome 2d6 as a substrate. Quick onset, 1 to 2 weeks. Selective serotonin reuptake inhibitors, also known as SSRIs. The SSRIs were first approved by the FDA in 1985 with the introduction of fluoxetine, with the brand name being Prozac, and quickly followed by paroxetine with the brand name being Paxil, sertraline with the brand name being Zoloft, fluvoxamine with the brand name being Luvox, citalopram with the brand name being Celexa, and escitalopram with the brand name being Lexapro. Vortioxetine with the brand name being Brintellix, the newest SSRI, was approved by the FDA in 2013. Because of their safety and equitable efficacy, their use has exceeded the use of TCAs and MAOIs. Pharmacodynamics. All SSRIs have selective inhibitory effects on presynaptic serotonin reuptake and weak effects on norepinephrine and dopamine neuronal uptake. Pharmacokinetics. Slow absorption, half-life 26 hours, has extensive first-pass metabolism. Fluoxetine half-life, 1 to 3 days, and first metabolite 4 to 16 days. Liver metabolism may involve cytochrome 2C19 and cytochrome 2D6. Adverse drug reactions. Adverse reactions to this group of drugs depends on which receptors are affected, but are usually relatively minor and transient. Most common are nausea and sometimes vomiting, headache, lightheadedness, dizziness, dry mouth, increased sweating, weight gain or loss, exacerbation of anxiety and agitation. Sexual side effects may occur in up to 35% of patients and manifest as diminished, delayed, or absent orgasm, premature ejaculation, and decreased libido. A significant adverse effect is serotonin syndrome, which occurs in the presence of excessive serotonergic activity. Patient education, adherence, avoidance of alcohol, avoidance of over-the-counter medications that stimulate, insomnia or drowsiness, and suicide ideation. Pregnancy, category B, C, or D. Withdrawal symptoms if abruptly discontinued. Monitoring. Never give more than 4 weeks on first prescription. Monitor target symptoms. Major depressive disorder, general anxiety disorder, neuropathy pain, and fibromyalgia. Not approved by U.S. Food and Drug Administration for use in children. Considered atypical antidepressants. Pharmacodynamics. Inhibit reuptake of both norepinephrine and serotonin. Pharmacokinetics. Half-life 8 to 17 hours. Metabolized in liver via cytochrome 1A2 and cytochrome 2D6. Forms multiple metabolites. Watch with antibiotics, quinolones. Adverse drug reactions include the following: headache, somnolence, dizziness, insomnia, fatigue, dry mouth, constipation, orthostatic hypotension, erectile dysfunction, and ejaculation failure. Patient education, adherence, suicide ideation, and avoidance of over-the-counters. Monitoring may increase serum transamine levels. Watch in patients with liver disease. Monitor suicide risk and activation of hypomanic or manic symptoms. Hello everyone. Today we will be finishing up the topic about drugs affecting the central nervous system. Buspirone is a serotonergic that is a member of the azapyrones, a relatively new group of anxiolytics. Buspirone. Pharmacokinetics. Takes 1 to 2 weeks for onset of anxiolytic effects, up to 6 weeks for maximum effects. Adverse drug reactions, few. Drug interactions. MAOIs, SSRIs may cause serotonin syndrome and atypical antipsychotics. Monitoring, none needed. Patient education, prolonged onset and drowsiness. The patient also needs to be told of the prolonged onset and should be offered non-pharmacological strategies for anxiety management during this time. Barbiturates, limited to the following: pre-anesthesia sedation, short-term treatment of insomnia, and status epilepticus. Central nervous system depressants bind to GABA receptors. Contraindications include alcohol, history of depression, or suicide attempts. Adverse drug reactions include central nervous system depression, agitation, confusion, and hippuric acid. Drug interactions include central nervous system depressants. Monitoring of therapeutic levels and narrow therapeutic range. Insomnia may occur transiently, lasting only a few days, short-term lasting 2 to 3 weeks, or chronic lasting longer than 3 weeks and even years. If sleep is still a problem after treating the underlying problem, the most common sedatives or hypnotics include benzodiazepine and non-benzodiazepine GABAergics. Non-benzodiazepine hypnotics also act at the GABA receptor but not at the benzodiazepine site. There are 4 drugs in this class, including Zolpidem, with the brand names being Ambien, Edlar, and Intermezzo. Zaloplon, with the brand name being Sonata, and azenopiclone, with the brand name being Lunesta. Contraindications include pregnancy, children, older adults, and long-term use. Adverse drug reactions include somnolence and abnormal behaviors. Patient education. Avoid central nervous system depressants. Take immediately before bedtime and get 6 to 7 hours of sleep. Mood stabilizers are used with patients who have bipolar disorders with evidence of depressive and manic or hypomanic episodes. Lithium carbonate, with the brand name being Lithobid or Escalith. Mechanism of action unknown. Absorbed in GI tract. Has no protein binding. Not metabolized in liver. Excreted by kidney. Long half-life, 15 to 36 hours. Steady state, 5 to 7 days. Very narrow therapeutic index, 0.6 to 1.5 milliequivalent per liter. Monitor levels every 10 to 14 days after initiating, and then every 2 to 3 months thereafter. Adverse drug reactions include narrow therapeutic index, toxicity, and ECG changes. Monitoring blood levels 14 days after starting, 14 days after dosage changes, and then every 3 to 6 months. Patient education. Maintain adequate salt intake. Valproates. Pharmacodynamics. Blocks GABA. Pharmacokinetics. Metabolized by cytochrome 2C9, 2C19, and 2A6. Possibly induces 2C9 and 2C19 and inhibits 2C9, 2D6, and 3A4. Contraindications. Pregnancy Category D. Drug interactions. Valproate in combination with other central nervous system depressants can lead to an additive depressant effect. Bleeding time can be increased in combination with anticoagulants. Combinations of TCAs and valproate can lead to increased risk of cardiotoxicity. Monitoring. Monitor plasma levels every 3 months. Patient education. Bruising and delayed clotting. Non-classified mood stabilizers. The non-benzodiazepine GABAergics used in the treatment of epilepsy have shown effectiveness in treating bipolar states, as might be expected based on the data about valproate. Non-benzodiazepine GABAergics include lamotrigine, with the brand name being Lamictal, gabapentin, with the brand name being Neurontin, and topiramate, with the brand name being Topamax. Adverse drug reactions include somnolence, dizziness, and weight changes. Topiramate has 1% chance of renal calculi. Patient education. Adverse drug reactions. Muscle relaxants and antispasmodics. Muscle relaxants and antispasmodic drugs are used to treat severe muscle spasms and the associated pain. The two categories of muscle relaxants are those that act in the central nervous system and the direct-acting drugs or antispasmodics. Centrally acting includes the following: baclofen, with the brand name being Leoricel. Carisoprodol, with the brand name being Soma. Chlororoxazone, with the brand names being Paraflex and Parafon Forte. Cyclobenzaprine, with the brand name being Fluxaril. Metaxalone, with the brand name being Scalaxin. Methocarbamol, with the brand name being Robaxin. Orphenadrine, with the brand name being Banflex and Norflex. And tizanidine, with the brand name being Xanaflex. Direct acting includes the following: dantrolene, with the brand name being Dantrium, and botulinum toxin type A, also known as Botox. Exact action unknown. Contraindication, specific for each drug. All are contraindicated in pregnancy. Adverse drug reactions include central nervous system sedation and respiratory depression. Chlorroxazone may be hepatotoxic. Drug interactions include additive sedation with central nervous system depressants. Patient education includes appropriate use and central nervous system sedation. All of the muscle relaxant drugs are sedating, and patients should be cautioned not to drive or combine them with other sedating medications or alcohol. Muscle relaxants are for short-term use only. Therefore, non-pharmacological therapies should be addressed, including heat/cold, physical therapy, and back exercises. Dantrolene, used to treat spasticity associated with upper neuron disorders. Contraindicated in active liver disease. Adverse drug reactions include central nervous system depression and confusion. Patient education. Titration schedule. Botulinum toxin type A, injected to provide localized reduction in muscle activity. May spread from site of injection to mimic botulism. May require mechanical ventilation. Opioid analgesics and their antagonist. When non-opioid agents are ineffective for pain relief, opioids are the next logical step in the treatment of pain. These agents alter the perception of and response to painful stimuli. This group of drugs includes natural opium alkaloids, synthetic agents, and a combination of the two. Most of these drugs are Schedule II narcotics under federal law. Although many states allow prescription of these agents by nurse practitioners, state laws may vary, and all prescribers are required to have a Drug Enforcement Agency number. Morphine is the prototype. All opioids rated against morphine. Single-agent products include oxycodone and morphine. Combination products include Vicodin, Percocet, Percodan, and Tylenol with codeine. Pharmacodynamics bind to opioid receptors in central nervous system. Pharmacokinetics vary. Adverse drug reactions include central nervous system sedation, constipation, and euphoria. Patient education includes adverse drug reactions and drug interactions. Monitoring include adverse drug reactions, withdrawal, and refills. Stimulants. The FDA approved the use of stimulants in treating attention deficit hyperactivity disorder, also known as ADHD, and narcolepsy, and for weight reduction. In therapeutic ranges, these drugs improve alertness, mood, attention, wakefulness, vigilance, and psychomotor performance and have an anorexant effect. Amphetamine, methylphenidate, dextroamphetamine, and amphetamine. Pharmacodynamics includes central nervous system stimulation and reward centers, contraindicated in heart disease, hypertension, and pregnancy. Adverse drug reactions include insomnia, weight loss, palpitations, and hippuric acid. Patient education includes adverse drug reactions and drug interactions. Monitoring, monitor adverse drug reactions, amount of drugs used, and refills. Non-amphetamine. Atomoxetine, with the brand name being Strattera.